We're going to go ahead and start the Gallatin County COVID-19 press call. Today we have on the call Lori Christenson, our Gallatin City County Health Officer, Kallie Kujawa, who's the Chief Clinical Transformation Officer and Bozeman Health COVID-19 Incident Command Lead. We also have Tracy Ellig, the Vice President of University Communications for Montana State University. Turn it over to Lori.
Okay, good afternoon, everyone. I'm going to go ahead and start with our weekly surveillance report. So on figure 1 here, again, this is describing the total number of daily cases and our 7-day rolling average of cases per 100,000 residents in Gallatin County. And you can see on the far end of our figure here, we are seeing a pretty sharp decline in the number of cases per 100,000. And so the 7-day rolling average of cases per 100,000 was 92.7 cases on February 2nd. And that is representing a 58.5% decrease from where we were last reporting period, which was the 22.3 cases. I do want to remind individuals that we continue to experience high community transmission. We're still seeing a number of cases than we've seen in other times during the pandemic. So continue to take all those precautions, like wearing your mask, staying home when you're sick, getting vaccinated. Figure 2 here is you'll see a very similar trend in terms of our percent positivity. The 7-day rolling average of percent positive was 19% on 2/1, and that's representing a 24% decrease from the positivity rate that we saw the previous reporting period. Again, this red bar here is indicating 10% positivity rate. And so with our case numbers right now, we continue to see above 10% upwards into the 19%, as I mentioned. So almost double that 10% positivity rate. In terms of test turnaround time, we're still seeing median test turnaround time is 1 day to public health, which is excellent. We want to continue seeing that. And again, these are our figures as it relates to cases and the vaccination status, as well as the hospitalization and vaccination status as well. In terms of our percentage of Gallatin County residents by age group who have been fully vaccinated, our 5 to 11-year-olds, we actually saw about a 2% increase in this age range in terms of those who became fully vaccinated. We really like to see that trend, and we want to continue to see that. The other the bolded numbers indicate a 1% increase. So we saw a 1% increase in our 12 to 17-year-olds as well. And then this figure represents vaccinations received by Gallatin County residents by their dose number. So again, the blue bar is representing a first dose. So we are continuing to see individuals who are seeking a first dose. Orange color here is representing second doses. And then the green here is the booster dose. So again, we continue to see individuals seeking vaccine, and we continue to support those efforts. So thank you to our Gallatin County residents who continue to seek vaccine, and all of our vaccine providers out there who are administering them as well. This this table describes the number of active cases by different age groups. And you can see that our 30 to 39-year-olds, 40 to 49-year-olds in terms of active cases per 100,000. They are kind of amongst the highest, followed by some of these other age groups as well. And then last thing I'll mention on the surveillance report today is we continue to be experiencing high community transmission. So again, that recommendation is to wear a mask indoors, regardless of your vaccination status. So thank you again for folks who are adhering to that. So I'm gonna stop sharing and then just share a couple of other really quick updates. So I wanted to just provide a quick update on the test site that was made possible by the CDC and our federal contractors that was set up at the Gallatin County Fairgrounds earlier this week. And I just wanted to remind individuals that that site is open Monday through, or excuse me, 7 days a week from 8 a.m. to 6 p.m. Visitors can go to our website and pre-register for and schedule an appointment. If you're unable to register for any reason whatsoever, there are individuals who can assist with that on site for that pre-registration. So you can seek a test when you need it as well. And then I also wanted to briefly mention our at-home test kit distribution in partnership again with Gallatin County Emergency Management and a number of distribution sites throughout Gallatin County. I'm happy to report that we received those kits end of last week, those 22,050 kits last week. And currently we have about 5,800 test kits still in the warehouse. That means that over 75% of those test kits were distributed out to various distribution points throughout the county. So if you're seeking a at-home test kit, please definitely go visit one of those distribution sites. We will send out some communication later today that updates some of the additional distribution sites that we've been able to secure. Again, thanks to those partners who are willing to take on that effort so that we have good broad range access points throughout the county. So with that, I will turn it over to Kallie for any Bozeman Health updates.
Great, thank you, Lori. So right now we currently have, let's see, let me get the right info up here. All right, so right now we currently have 24 COVID-19 positive patients at Deaconess Hospital. We have no COVID-19 positive hospitalized patients at Big Sky Medical Center. Our critical care unit at Deaconess Hospital has 20 beds and is currently at 95% capacity. Only 6 of the 19 patients in the critical care unit are COVID-19 positive. Additionally, our medical unit is at 100% capacity and our surgical unit is at 61% capacity. Shifting gears a little bit, I'm really glad to share that Bozeman Health has administered more than 80,000 COVID-19 vaccines in the past year. We are extremely excited by that number and are really happy to continue to see that number grow. During a recent site visit by DPHHS, who was here just this week, we visited with the state vaccine coordinator, and she noted and commended our quality, safety, and our other processes to support the multiple vaccines and doses that we are administering for all qualified ages here. I was so proud during that site visit of the creative methods our teams are utilizing to assure that we verify the right vaccine is given right from the point of registration all the way to administration. We are keeping an eye on what the next few weeks will present with potential CDC approval of more pediatric vaccines for those kiddos under the age of 5. And we are working with our vaccine team as well as our pediatricians to develop a plan to get those younger children safely immunized within the provider's offices during typical visits and adding on visits to get those kiddos immunized right within their provider offices. We'll look forward to sharing more updates as we move through those approvals at the federal level. Moving into testing now, as of 8:30 this morning, this week so far, we have processed 1,055 swabs for COVID-19 testing. And that's compared to 1,963 swabs that we processed last week. These numbers that I just shared include our testing sites at Deaconess Hospital, Belgrade Clinic, and our B2 Urgent Care Main Street location. Over at our Big Sky Medical Center, this week we have processed 140 swabs for COVID-19 testing. And last week we processed 173 swabs. As Lori mentioned, COVID-19 testing for Gallatin County is changing a bit. I shared our testing volumes that have declined, and Lori has shared some info there as well. But we are really grateful for the assistance and the partnership with ICAT True North, which is the federal testing program that Lori mentioned, so that our community can have expanded access to testing. But with this new option, Bozeman Health is working to deploy resources to other areas within our health system. And as a result, we are making some changes to our testing sites. So as of today, the Belgrade Clinic urgent care drive-through testing site is closed. They are definitely collecting specimens at our Belgrade Clinic urgent care site. It's the drive-through option that has ended. Our Deaconess Hospital Lot H drive-through testing will close at the end of the day next Friday, February 11th. We will maintain testing at Big Sky Medical Center, at Belgrade Clinic Urgent Care, just not the drive-through option. Testing will continue as is at our B2 Urgent Care location, at our B2 Micro Care location, and then at all of the outpatient lab locations at Deaconess Hospital and throughout the community. While we are glad to see testing volumes decrease, I want to remind everyone that it's still very important for us to adhere to our infection prevention measures to keep you and your family safe. It's also important to stay home when you have any signs of illness. And we just continue to thank all of you who are regularly washing your hands or using hand sanitizer, wearing masks in public spaces, and socially distancing when able. So thank you.
Tracy, do you have any updates for MSU you'd like to share?
Thanks, Lori. So MSU has a walk-up testing center next to the stadium for students, and our testing volume has also declined over the past week. We're down about maybe 16% from where we were last week. I also like to thank Lori and the county for helping us be one of those sites of distribution for the at-home tests. We make those available to students who are living on campus in the residence halls. And in the first day that they were available, about over 500 of those were distributed. Students came up and got them. So we're very grateful for that partnership. We continue to require masks on campus in all our indoor spaces, and continue to urge students, if they haven't been vaccinated yet, to get vaccinated or to get their booster. So mostly it's business as usual in terms of the steps we're taking. Thank you.
Thank you, Tracy. Okay, so at this point, we'll open it up for all of you if you have any questions.
Hey guys, it's Juliana. I have a couple of questions for you all. I guess the first one, because I wasn't here last week, and that little downward turn seemed a lot more dramatic from 2 weeks ago for our cases. I'm wondering if it's safe to say we're kind of approaching our Omicron peak, or if we've peaked in cases now.
Yeah, thanks for the question, Juliana. So we are seeing a 2-week decline in our cases, which does appear to mean that, at least for now, I always caution in terms of trying to predict what may happen in the future. But it does appear that we are trending down from where our case surge was previously.
Well, hopefully that trend stays. and we keep seeing that.
We have consensus there for sure.
I'm also curious if you know how many of those at-home testing kits have been given away so far.
So we have distributed, like I mentioned, over 75% of what we were allocated.
Okay.
So in terms of what the availability is, in terms of those exact numbers per each of those sites, that's not something that we'll have access to. We just want individuals to know that they're available in those locations. And if we see a continued uptick, we will reassess and see if we can secure more from the state if more are available.
Nice. And then this is kind of a question, I guess, for everybody. I'm wondering how much testing demand has declined. You each kind of said that it has at your all respective locations. I don't know if there's any way to quantify that, or how much it's declined.
I could start. In our Bozeman and Belgrade combined testing sites, I would say it was almost, but not quite, if I do quick math, 50% decrease week over week. In Big Sky, it was not that dramatic. They had 140, I believe I said this week, and 173 last week. So that's not decreasing quite as much as we're seeing in Bozeman and in Belgrade combined.
Has this all just been this week, or has the decline been over the last couple of weeks?
We've noticed a decline at our testing sites for, I think, the last couple of weeks, maybe. But Lori, I don't know if you have specific numbers that we could pull up again on tests collected or tests reported versus the positives.
So I think the best place that I would point people to, and Juliana, I could point you to that, as well as our COVID-19 data dashboard that really has kind of the daily test count by day. And you can see here, I'm just going to share my screen again. Hopefully this goes well. All right, can you guys see the blue screen?
Mm-hmm.
Okay, so this is the daily test count. So you can kind of hover over the different days, and you can see as you kind of move through these that we've definitely seen the daily test count reduce overall. Does that make sense?
Yeah, for sure.
Okay.
That totally makes sense. That's
Okay.
easy visualization. Yeah,
Juliana, just to reiterate, I mean, our numbers, we figure are down about 16% from last week. We have, you know, our testing, I guess, sounds like it's comparable to what's done at Big Sky. We had 179 tests last week, and we've had 153 this week.
Thank you. And then I had another question for Kallie. I guess what was kind of the thought process behind closing the Lot H testing site? Is that just because you're seeing less demand, or there's anything else that kind of motivated that?
Yeah, we're really seeing less demand. We're also wanting to find ways for our patients who are coming in for appointments to get those tests closer to where they seek care, and making it more integrated back into typical operations and having it less separate from our clinical workflows and our patients' pathways throughout our physical spaces. We know it's a convenience factor for the rest of the community if they're not established as a patient here. But now that we do have that ICAT program at the fairgrounds, those who aren't established patients with us can seek testing there. We still welcome anyone to come to Bozeman Health if they have an order for a test at one of our outpatient sites. However, this option at the fairgrounds allows people to do that without an order necessarily. And then with the access to home test kits, that's really helping us as well. So people are able to get access to test more. And that may be why we're seeing some of the decline in the demand at our drive-through sites as well.
Makes sense. I am wondering though, since that ICAT, I think that was the right acronym, is closing by the end of February. I think it was just temporary. Do you anticipate needing to reopen that Lot H or re-up testing at the end of February when that closes?
Yeah, we are going to remain extremely flexible as we have throughout the last 2 years. We've been reflecting a little bit. It's on February 10th, 2 years ago almost, is when we got our first person under investigation here in Montana. We were the first in the state. And so, you know, we've learned how to scale and scale up and scale back operations like we've never had to do before. And so we have plans if we need to do that. But also our urgent care locations and our outpatient lab sites are much more equipped to scale, more so than they were before. So we'll look at all of those things to see if we need to stand up Lot H or the drive-through at Belgrade. But we're not anticipating standing it back up unless we see those really wild volumes like we saw in the last few weeks.
Sure.
Mm-hmm.
That is insane to realize that February 10th is the 2-year anniversary.
Yeah, day after my birthday, I'll never forget it.
Oh no, well, happy pre-birthday.
Yeah.
Cool. And then I don't know if this was asked last week or not, but with that ICAT testing site, I'm kind of curious on the timing, if that was just because it seems like it's a little bit behind when our really crazy surge was, and I'm guessing that was probably just a lot of bureaucracy, but I thought I would ask.
I'd be happy to take that one because it's a question that has been raised previously. So we applied for that in the middle of January, and from application to having boots on the ground and testing, that took 2 weeks. So in terms of like setting up something of that scale that quickly, it's a pretty fast turnaround time. What I would also say is, you know, when we considered where we were in the middle of January, early of January, it was extremely hard to predict where we may be headed, how long our surge would last, how many more cases we would be adding. And we were definitely seeing some some pinch points across the way in terms of our healthcare system. So it was a resource that became available to us that we applied for, and just happy that we can provide it for the community at this time. Does that help answer your question, Juliana?
That does for sure. How helpful is that to have? Because I know some of the struggles before has been getting staffing to staff the testing site, and I don't know if those are county staff or FEMA people, but how helpful is that even with the decline in testing demand to have that extra site?
That was a huge contributing factor in the fact that this was a federal contractor who would be standing this up. We have Gallatin County Emergency Management who is providing some site support, but really the main benefit to our community, based on some of the earlier conversations we've had about testing and being able to continue to offer that in a community setting like that, has been some staffing challenges in order to keep something like that running. So definitely that was a contributing factor as well in terms of the timing of bringing those resources in too.
Well, I think those are my questions for you, unless I think of something else. So thank you guys.
Yeah, thank you, Juliana. Any other questions today? Okay, well, with that, thanks for joining us today, and hope you all stay safe, and we'll see you again soon. Take care.